Hello, viewers. I'm Ruchika Kumar, your host, and I'm joined by my esteemed colleague, Dr. Shweta Singh, our consulting editor. Together, we welcome you all to the CSR Universe Leaders Talk segment, a platform dedicated to meaningful conversations and constructive dialogues with thought leaders, industry experts, and social entrepreneurs from the CSR, ESG, and sustainability domains. Now, these individuals are driving positive change and transforming lives through their innovative approaches, unwavering dedication, and commitment to creating a more equitable and sustainable future for all. And today, we have the honor of introducing you to a remarkable individual and a change maker whose tireless efforts in promoting gender inclusion and social development have left an indelible mark on society. Meet Dr. Kalpana Sankar, co-founder of Hand in Hand India, a non-profit organization working to alleviate poverty through a unique integrated community development approach with a key focus on women empowerment, microfinance, child labor elimination, education, health, environment, IT, and governance. A very warm welcome to you, Dr. Shankar.
Thank you.
So, Dr. Shankar, before we commence with today's conversation, I'd like to briefly share the illustrious profile of our expert, Dr. Shankar, over here. So, with a distinguished career spanning over 2 decades, Dr. Shankar has been a trailblazer in the realm of financial inclusion and social empowerment. And Dr. Shankar's transformative work with Hand India has touched the lives of millions across rural India, empowering women and creating sustainable opportunities for growth and prosperity. With a background in nuclear physics and a double doctorate, she brings a unique perspective to show social entrepreneurship. And she was recently honored with a Lifetime Achievement Award in Financial Inclusion and recognized with prestigious accolades like the Nari Shakti Puraskar and the Global Award for Women Empowerment. From empowering over 4 million households to creating over 8 million jobs for rural women, her impact resonates profoundly. And this is not all. Dr. Shankar's global influence spans collaborations with organizations like UNOPS, UNDP, and Christian Aid. And she has also served as a monitoring and evaluation officer for IFAD, which is the International Fund for Agricultural Development. This is not all. She's also authored publications on critical topics such as child labor and microfinance. And beyond finance, her passion also extends to founding organizations addressing diverse social challenges, including sustainable waste management and housing finance for marginalized communities. Her academic journey includes earning an executive MBA from the very prestigious Triumph, providing her with a comprehensive understanding of global business practices. So today we have the privilege of exploring her remarkable work and the commendable work her organization is doing. So again, Dr. Shankar, you're very, very welcome. And thank you so much for joining us. So before, we start about talking about the bridging the gap in terms of gender and promoting inclusivity, the first question that I'd like you to, tell us is how did you make this transition from the world of science to coming to the forefront of social impact? And in fact, if you could share what inspired this transition and how the concept of hand in hand came to fruition.
Yeah, I think I should say it was a coincidence or an accident. I'm not able to uh, describe. I want to thank you, Ruchika, and the entire CSR Universe for giving me this opportunity. I did my graduation in physics and then I wanted to do my doctorate. I enrolled at prestigious math science. We used to have professors from Stanford, Berkeley teaching us at math science. It was a very known place for theoretical nuclear physics. After that,
Mm-hmm.
I defended my thesis at Presidency College. Professor Subramanian Chandrasekhar and Sir C.V. Raman actually defended from the same hall where I defended my thesis.
Wow.
But I did not know the importance of my work till I read Einstein's biography, where he speaks about his involvement in Los Alamos project. My thesis was reviewed by Professor Nix of Los Alamos, and he had said a very commendable thesis work. So only on that day, after reading that biography, I went and told my family members. Nobody bothered to give me a treat also, because it was just like not an ordinary occurrence. Nobody felt it was a very remarkable achievement or anything. And then but and the opportunities in the field of theoretical nuclear physics was a bit limited. Um, so I felt I could help Dr. Shanta, and took an internship at Cancer Institute. Uh,
Mm-hmm.
so of my specialization in that field, nuclear science, but I found that too overwhelming. Then I got an opportunity to head Red Cross. I really jumped on that opportunity because one thing is reading about poverty in the papers and in reports. The other side is to actually work with the poor. So I really liked that. I was ex officio secretary of Indian Red Cross chapter at Coimbatore. I liked the job. And then I specialized on microcredit when I joined the government as a monitoring and evaluation officer for IFAR project. That was the beginning of my transformational journey.
That's wonderful. And I think this scientific background definitely helps you, in problem solving, because social development, the sector is also, very scientific. You have to be very pragmatic in your approach to solve the problems at hand. So let's begin with a conversation on how Hand in Hand India, under your guidance, has been, bridging this gender gap and promoting inclusivity and social development, especially for the underprivileged women community.
Like, thank you. I always believe in teamwork and collective wisdom, because you can provide leadership, but it is the team which actually implements the project. And right from day one, we have been focusing on community development and even team development. So even my board used to say, don't write I, because there will be collective ownership only if you say we. So that has been the um, uh, focus of our organization. According to the World Economic Forum gender gap study, if you talk about bank account opening, I think it is in proportion to the representation in population. The difference between men and women is about only 2%. So it is
Mm-hmm.
almost in proportion to the population, but we have a huge gender gap in terms of literacy,
Hmm.
longevity, income, and even access to financial services. So
Right.
basically, at Hand in Hand, we are trying to contribute on three major aspects. One is digital training. We feel that can really bridge the digital divide, which still persists, and also
Okay.
functional literacy training. Because first they have to be literate, then only they can be
Absolutely.
or tech savvy. So we try
Right.
to bridge the um, digital divide, and then focus on functional literacy to promote numeracy. And they're also able to use mobile phones for transaction, for promoting their products, and connecting with for applying for government subsidies or schemes. So we train them on various aspects so as to
Mhm.
empower them. We want them to have an increase in income, because one thing is giving credit. The second part is empowering them to bridge the digital divide and even bridge the gender gap. These are the three crucial areas we have been focusing. First is I spoke about the digital training, functional literacy training. Third is using mobile and all the other apps to access government programs. We also, through the training programs, try to avoid stereotype. Wherever it was possible, we have challenged the local status quo, and we have introduced new training program, which is more which can fetch higher income, and also make women feel more confident, like in very tribal belt in Rajasthan. When we introduced driving, they were very scared initially. Then we have promoted nearly 40 odd people, women. They are now driving e-rickshaws, uh,
Wow.
and in Madhya Pradesh, we have actually trained women in the production of LED lamps. their quality compares with that of Philips and other things. So, but it not only makes them confident, they feel they are doing something on par with men, and their income is substantial. And smaller incidents, like even in the area of pottery, when we introduced machinery, the men allowed them to remove the wheel because they could not use pottery machine with their gungoat or the whale what they used to use.
Okay.
These small incidents actually go a long way in giving them confidence to negotiate not only with the people at home but also with the outside stakeholders.
Okay, Dr. Shankar, you're particularly talking about the rural belt in Tamil Nadu. So there must have been instances of success stories because see, any development project to become successful needs a lot of community engagement. So can you share any stories of success coming from these regions which can be replicated or are scalable in across the country?
Yeah, like we are working in across 16 states now. So we have managed to transfer the knowledge, whatever we gain
Oh,
from Tamil Nadu to other states as well. Like first we mobilize them as self-help groups.
mm-hmm,
They are matured after 5 to 7 years. We promote network so that the role of hand in hand can be to we will focus on less penetrated areas. These come
mm-hmm,
the network can actually take the role of hand in hand and work with the communities, facilitate discussion among the peers in terms of knowledge sharing among the SAG women, and also lobby with the government. So we have seen women, once they're, we have to train them on group dynamics, importance of savings, family budgeting, and
mm-hmm,
husband would have saved around 200 crores. It's not a, like it's today it's a very big amount, but when we started to inculcate that habit. It is in the bank. Several groups in Tamil Nadu, if you see, they have savings over 10 lakhs. They don't need support from anyone. They can have to just go to their group meeting, borrow 1 lakh, whether it's a wedding at home or somebody needs some surgery. So they become totally self-reliant. And many of them, nearly 400 of them, have got elected into the local self-governance also. And not only in Tamil Nadu, in Madhya Pradesh, we have seen that in Madhya Pradesh, Rajasthan, wherever we are working intensely, we are able to see that sort of a transformation. First, it is social empowerment, and then when they set up an enterprise, they are having additional income, and then there is economic empowerment, and then they move on to political empowerment. We have seen women taking charge of the lives of other women who are marginalized. So in several, in one of the villages, they provided houses to the tribals who did not have any houses, to migrant population, even providing access to sanitation. Lot of schemes are there. But
mm-hmm.
they have to be sensitized to actually take the benefits to the people who need the benefits, helping the people also to apply, fill up the forms. They are illiterate, so it's very pathetic. Even now, Tamil Nadu is slightly, if you compare per capita and other things, it may be better off than other states. Last week,
Mm-hmm.
we were in a village, we were attending a medical camp. Still, many of them do not know what their age is, what is their health issue. So they are, and so somebody has to sit with them, understand the situation, help them fill up the forms. Government subsidies are available. To access those subsidies also, they need hand holding and mentorship. And we have created nearly 200 villages where we have ensured that all the families are covered through various security schemes of the government. I think that was the biggest learning. Accident,
Mm-hmm.
there is insurance coverage. For girl child, there is insurance. For spouse death, there is insurance. And it is 340 rupees or something, which is very affordable. So we
Mm.
encourage the entire village to apply for those schemes. Nearly 200 villages in Tamil Nadu, we were able to ensure that they were fully socially secure, and that we are trying to replicate in other parts of the country.
That's wonderful. And I think the SSGs has actually be served as a backbone for all the development projects under
Yes.
your guidance. Yes, that's great. Shweta, you had a question?
Yes, yes. I actually my question is slightly a broader one. because you've been working so extensively, and in fact, you've actually gone very deep into the areas that you work in. And for such a prolonged period of time, you've been working there. So, besides your work, I wanted to know what kind of shifts that you've been noticing in this period, in the situation of women. I mean, do you notice any positive, or of course there would be shifts, but what are the major shifts that you're noticing 20 years ago versus what the situation is today? You know?
Many things are positive in terms of knowledge, awareness has improved. They were illiterate, but their children are all literate now. Many of them are engineers, and some of them are even doctors. Many of them
Right,
for the government. So they proudly say we were illiterate because of the SHG movement. We were able to invest in education of the children. That is one very positive development across India we see. And even access to clean water and sanitation. Everyone realizes otherwise they have to spend
right.
on health. Those things are positive. And increase in income, confidence levels, mobility, negotiating their rights with government. Before when I was working for the government, that was in 1994, 95, when we used to tell them we have to open a bank account, please come to the bank. They used to be so scared. They used to shiver as though they're doing a sin to walk
Mm,
into a bank. Today, they're even able to argue with the chief minister. You said you will come by 11 o'clock. You are coming by 1 o'clock. You think we don't have other work. So they're in terms of lobbying and so that they become more confident and mobility also. They are participating in various seminars and government offices and secretariat. All those factors, it's really a plus. And in India, the focus on Jan-Dhan account and the way financial inclusion, I think India, we have provided a very big, powerful model for the rest of the world to actually learn lessons from. So women are able to get benefit in terms of access to credit by being a member of a group. All those things are really positive. But the flip side, if you have to see, the group concept slowly is dying down. Very few institutions are practicing the group concept because now it is more an MFI culture. People just come together for the sake of credit. So the
Hmm.
dynamics is not there any longer, I should say. But still, where we are able to focus, give more time, spend through technical assistance, through grants, we are able to institutionalize it. So it is more expensive, and also we need grant support to actually keep the group structure intact. That is one thing. Second is digital has more plus and minus. I see a
Hmm.
lot of abuse of phones, especially by adolescent girls, and parents are not able to control. That is one flip side, I should say. Third, when we used to start the SHG movement, money used to be the constraint. Now, all of them are able to save, they are able to access credit, but health, they are ignoring the health. The food pattern, everything has gone. They used to, initial stages, they used to have millets, avoid things like rice. Now, for the sake of convenience, everybody they are shifting to burgers and all fried stuff. So they become very unhealthy. In the age of 40 and 50, we are coming across death due to non-communicable diseases. That really pains me because we feel all those things can be avoided because of lack of ignorance. I think we have to work more on preventive health and advocacy, linking them with government hospitals. So I think that should be the area of the focus currently because other aspects we are improving, but in terms of um, uh, like advocacy and other things, we are still lagging behind.
Okay.
So, Dr. Shankar, I was just going through the website and we found out that Hand in Hand India follows a very, a five-pronged approach.
Yeah.
So, if you could, shed some light on that, in alignment with the objective of financial inclusion and bridging the gender gap. And if you could also shed some light on the job creation model that you're talking about, which can be, scaled across the country and which, other corporates or other NGOs can also, adapt and work towards.
First, I will share about the five pillar program. Because we started off only with child labor elimination program. So if you go to a family which is not able to afford even 3 square meals a day, and if you tell them send your children to school, it was a very difficult proposition in the initial stages, because unless they have sufficient food to eat, they will not focus on other aspects like education or even
Mm.
sanitation. Only then we realized that poverty is multidimensional. Then looked up at literature, and we started following UN multi-deprivation index. So that has been very useful. We use that as a basis to conceptualize the five pillar program. So we started with child labor elimination and focusing on education, then moved on to women's empowerment. We first mobilized the mothers of child laborers as self-help groups, and then gave them training on access to savings, credit. They were
Mm-hmm.
primarily reviewers, helped them to eliminate the middleman, and got some direct procurement orders. They were able to see increase in income. So then the husbands also started contributing to the family kitty, and then they started sending the children to school. So and that was the basis of our women's empowerment program. So when we launched in 2004, there were several institutions which were providing training, and there were several institutions which were providing microcredit. But the combined synergy was the missing factor. So we tried to combine the two. We not only provided the training in terms of skill training, business coaching, providing them access to markets, but also we gave timely credit at an affordable rate. When we started, we gave credit at 12% diminishing rate. That was the beginning of our institution. So
Mm-hmm.
that really helped them to come out of poverty at a faster pace. In addition, one chikungunya or one malaria, if you talk about the life cycle of poor people, they are affected for 6 months, and for them, their bodies are only as because they earn
Right.
through their hard work and daily labor. So we felt we have to work on preventive healthcare. That then only we started conducting medical camps. So if they had some health issues, started referring them to government hospitals, working in
Okay.
partnership. So, and anemia, malnourishment, we have created very good models which can be replicated across the country. UBS Foundation was very appreciative of our work in malnourishment space in Madhya Pradesh. We had a two-pronged approach, how of empowering the women who are pregnant through women collectives, suggesting skill training which they could undertake even during pregnancy to have an increase in income to take care of their health. And anemia is one area where we have worked in depth across the country, and even access to clean water, sanitation. The last thing in health, what we do is providing access. We have set up health desks in 6 government hospitals across India, in Rajasthan, in Jharkhand, in
Mm-hmm.
Tamil Nadu. Basically, poor people go to the hospital in the end, many of them are illiterate. If 200 people end up at the same time, they are not able to service. And that golden hour, all of us know, if there's a heart attack, they have to be attended immediately. They need blood, it has to be serviced. So the help desk, it's like a private hospital. We are providing the salary for 4 people. We have provided them with IT gadgets so as to record the cases,
Mm-hmm.
patients who are coming, and they are familiar with the hospital, so they refer the patients on time to the hospital. So this is one very big service. On an average, every day they have a footfall of about 20,000 people. We are able to service them through the help desk in a very meaningful way, helping them to get access from government facilities. I'm very happy about that initiative. We've also set up good pilots even in the area of health in partnership with UNICEF, wherever it is needed. One ICNU, we set up at Tellar and Thiruvannamalai. It's a backward area. So they had to go to Vellore or other big cities for treatment. So we set up a state-of-the-art facility for neonatal babies born with jaundice. So that can be replicated across the country. Fourth pillar is skill development and technology, because we believe there has to be increase in income. They cannot be doing the way they were doing things 30 years before. So it has to have the latest design, and they should be able to market. That is possible only through skill training. So based on the literacy level, the geography, we offer skill training, and NSDC has set up very good standards for skill training, and we try to emulate whatever standards which NSDC has set up. And last area is the area of environment, because we used to have a lot of donors coming from abroad, and they used to ask, why is your country so dirty? Well, that was the beginning of solid waste management. We felt it is not rocket science. We can handle waste in a professional way, and we have been doing that from 2006. So we, at one point in time, we used to serve nearly 6 lakh households on a daily basis, collect waste and help in waste segregation. Right now, and we created good models in Mamalapuram, Karaikal. I think best models which can be replicated across the country. Now we are also focusing on ocean waste, keeping the ocean clean without plastics, and also helping them in livelihoods using plastic, how they can upcycle the wastage which is getting generated. And natural resource management is also a part of our environment pillar, where we focus on water conservation, climate resilient entrepreneurship, farmer producer organization, organic farming, crop rotation, whatever. NABARD has been very supportive. They provide the technical assistance, and that we take it to the farmers. We work nearly with 21,000 farmers, and we have promoted nearly a lot of FPOs so as to create sustainable farmer producer organizations.
Great. Dr. Shankar, I wanted to know, since there is an overlapping and interconnectedness, like you have this five-pillar approach, there is obviously an interconnectedness in between the themes, the different areas that you're working on. So, how has Hand India, supporting rural women, not just, financially, becoming financially independent, but also becoming environmental stewards? Is there any overlapping of work in that area?
Yeah, of course. And just to test the effectiveness of our model, because it is a donor-driven organization, in all the states and all the villages, we cannot say we are working in 6,000 villages, but in all the places, we don't have the five-pillar program. And at least in 800 to 1,000 villages, we have piloted combining all the five initiatives to see whether it is, how powerful is the impact, to see them impact of the programs. IIT Madras did a study to study the impact of our program, and they said for every 1 rupee invested in the women's empowerment program in the financial inclusion space, the return on investment was 42 rupees, because we were leveraging the local resources, training from the corporates, training from IIT Madras, and also whatever local knowledge was available, we were taking it to the grassroots people. To talk about climate related initiatives, if you like Clean Ocean project, we have been implementing for the last 2 years. We are working with local stakeholders, the self-help group women across the coastal villages, training them on how hazardous it is to use single use plastic, because a lot of animals, marine life is getting disrupted because of that.
Right.
And also
Right.
training them on livelihoods, like how they can use plastics for upscaling their enterprise, coming up with new training programs so as to generate wealth from waste. And if you ask me how they can actually be climate champion, we are working with a clientele nearly we have reached to 45 lakh people, but currently working with 29 lakh women, and
Okay.
family size of 4, that is a scale at which we can impact. And
Okay.
nearly 40 to 60% of them are involved in animal husbandry activities. So
Okay.
training them on proper waste management,
Mhm.
like biogas. These are some of the things I think if our women start championing, I think we'll be doing a great service to in the field of environment also. And this year at Belstar also, we want to focus on climate resilient products. I think we have to move
Okay.
because traditionally we have not done that much of research. Now there are new units which are coming up with solar fans, so many new initiatives. So solar panels for their homes. So I think we have a lot of sunlight in our country. We should harness the benefit
Yes.
and
Yes.
also go green. I think all of us have to be responsible and conserving water. These are some of the aspects we would like to train the community.
Wonderful. So besides this community engagement, how have collaborations or partnerships, helped you expedite your efforts? If you could talk about any partnerships that have been very successful, and please share an example with us.
Yeah, each and every partnership, we have something to learn. It's not the scale, but it's the spirit and passion. I think corporates bring in their own business principles and their wisdom in terms of uh, robust MIS or even audit systems. That we have learned from several corporates, and some of them have said even in our offices we don't have this sort of a rigor in procurement. Over a period of time for an NGO, we started off with 3 people when I joined the organization. Today, we are about 14,000 people, and our model is scalable, and it has shown that it is scalable and replicable. So I think that is the biggest plus. That has been possible because working with corporates like Vodafone, they give an opportunity for women to transact using the mobile. Not only skill training, but also they helped us create an app where they could actually sell their produce. It was a very big success among the women. It changed the way they were doing marketing, and they're very comfortable now using the several apps. So that was a very big learning through Vodafone, and even ADB project also was very successful. Through ADB project, we did through 2 projects with ADB in Madhya Pradesh. Uh,
Okay.
through like energy-based enterprises that reduce the drudgery of the women. And government of Madhya Pradesh got the award from ADP, I think in the year 2016 or 17, I don't remember, as the project which we implemented along with government of Madhya Pradesh was selected as the best gender inclusive project for the year by ADB. So ADB also let lot of learnings in terms of they are very, very particular about the analytical part of it, the needs assessment, because so that is one thing which I learned from, and the documentation, needs assessment and documentation, very strict, stringent standards that we learn from. Uh, I learned from ADB, and it has been a big learning for our team. And several, some people are very passionate about the cause. So, yes, some institutions have actually, they've never given up. So, that also we learned to be resilient. And government programs generally gives us a lot of confidence because we're able to implement things on scale. And working with NABARD has been NABARD, SIDBI. It has been a
Mm.
very, very positive experience. So recently, our team is working with the World Bank project for which I wrote the proposal, the initial proposal when I was working for the government. So we are trying to adapt to the changing times, trying to empower the communities in a meaningful way.
Wonderful. Shweta, you had a
So
question?
I had actually it's a kind of a concluding question because we're above the time. But I really, ma'am, it's you are such a personality. I mean, it's very inspiring to read about you and your work. When I was reading about the organization and the kind of impact that you've achieved, and I just want you to give a message to our readers, to our listeners, especially the women. What message would you like to give them to the women who are listening to this interview or who would listen to this interview? Just in the modern times. Uh, it's just something, I know it's a general question, but I didn't want to leave without this.
Thank you, Shweta. I
So,
think women should be empowered economically. That would be my first advice. Second, um, we should also learn how to negotiate, because we are always, I've seen many women, even in the top positions, approaching things in a defensive way. We don't prepare how to negotiate. I think that is one skill all of us should learn. And we should aspire to be someone. Like always, we are we have a lot of empathy. We are thinking about our family. We don't think about ourselves. So I think we should have our own aspiration, a dream for ourselves, and focus on health and work-life balance. And continuously, we should keep reading and equipping us, because we should not get selected because our constitution is very favorable. They have a lot of reservations, but we can actually provide leadership or sustain in any environment only if we have the competency. So that is also very important. I think women, we are natural leaders. We should make use of our innate talent and make the world a better place, and also help other women.
Beautiful.
Wonderful. That's great. So, Shweta, just one last question that I wanted to know from Dr.
Mm.
Shankar was that how do you envision the future of hand in hand in India? And also that your model has been replicated in other countries like South Africa, Afghanistan, and Brazil. So, what can you, if you share your insights on how this model has been so successful in all the other countries, and how you are envisioning this to go further and become even more successful, especially for the underprivileged women community in our country?
Yeah, like basically it is a needs assessment, and the scoping is very crucial, because then we understand the socio-economic problem of each place, and then discussion, secondary data analysis, and discussion with local stakeholders. All the three are very important to design a good program. And then we should have a baseline and a midline, so that even if there are some mid-course correction which has to take place, we can always provide such corrections and take it forward. So, what was your second part of the question, Ruchika?
The second part was the roadmap for the future for Hand in Hand India.
Yeah, we would like to deepen our services. Currently, I feel in the digital collections, we're at only 40%. There is a huge scope if we can increase it to 60 or 70, because women can save time. But they have to understand the pros and cons of digital. So we have to invest in digital training, and I would like to increase the digital penetration. And also, we have set up a goal of creating 10 million jobs, where we have reached 8 million jobs. We would like to strengthen and create. It's not that we have always, we have, see, like creating a job, it is either providing credit or a skill training or a marketing linkage. Based on the situation, we have helped nearly 8 million women and their families. Now we would like to expand it to 10 million families. And our focus will be more in the area of climate change, because we have a very large population, and I think it can affect us very badly if we don't take preventive steps. So whatever is possible from our end, we will do to promote climate resilient entrepreneurship. And working across other countries, I think a basic thing, if you feel sorry for any poor person, whether it is Cambodia or South Africa, the problem faced by poor people in terms of lack of access, they look so helpless. So you can always design a program which is meaningful by understanding the local situation, the local laws. So wherever there is an opportunity, a need, we are hand in hand. I would like to use the services of hand in hand to replicate and help more women in need.
Absolutely. Thank you so much. We'll definitely share this with our audience. And thank you so much for your time and for this wonderful insights. And the CSR Universe wishes Hand in Hand India all the best for more and more success. And we are always there to support you. Thank you once again for joining us today for this conversation.
It was
Thank
lovely
you.
talking to both of you. Thank you, Ruchika, Shweta, and the CSR Universe for